stakeholder in this community. I know you've only been here for a short time, 6 years, but you have focused and put a lens on the community of the Tampa Bay community, and I do appreciate that. So I would like to turn this over to you. Thank you so much.
Thank you, Tina. Thank you for having me moderate this panel tonight. And I want to thank everybody, the panelists, for participating, and for everybody who is watching. I just want to say thank you, because this is such an important issue for our community. We know that Black and Brown communities bear the brunt of COVID-19, suffering disproportionately from illness as well as death. And I was doing a little bit of research before the panel today and saw a new survey that came out that showed just 49% of African Americans are willing to take the COVID-19 vaccine. A lot of that has to do with mistrust that stems from history or things that have been passed down in our families. And these are things that we have to address if we want to address this very serious and deadly disease that is ravaging our minority communities. So with that said, we want to make sure that we have a very fruitful discussion, and we have a very distinguished guest panelists, and we are just so excited for that. So we're going to start out tonight by hearing from the Hillsborough County Health Department, the Florida Department of Health in Hillsborough County. We are so excited to have them here. We're looking forward to getting an overview of the state of COVID-19 in the Black and Brown communities right here in the Tampa Bay area. And when you talk about some of our workers on the front line, these are those people right now. They have been working day in and day out to make sure that our communities stay safe. And I sometimes feel that our health departments don't get enough credit for the work that they do. So we want to say thank you. And we're going to start out with Kevin Wattler. He's the Public Information Officer for the Florida Department of Health in Hillsborough County. And he's been the spokesperson for the department since 2017. And I've had the pleasure of speaking with Kevin on many occasions as I'm working on stories, trying to get information. And he's always been very helpful and worked very hard to get us the details so that we can share that information with you. So with that, I'm going to turn it over to Kevin, who again is going to give us an overview of the state of COVID-19 in our Black and Brown communities in the Tampa Bay area.
Thank you, Emerald. Well, again, I'm Kevin Wattler, and I'm the spokesperson for the health department, like you just heard. And so my job is really to make sure that you are informed. And that's really what my hope is to make sure that you are informed, because information is powerful. And when you are informed, it allows you to make informed decisions, and ultimately it could save lives. And that's exactly what we want. And so I'm going to first bring on one of our subject matter experts, Jules Bernard. She's an epidemiologist with the Florida Department of Health here in Hillsborough County. And she's going to give you kind of the state we are in. And then after that, we'll go ahead and move on to Allison Wen. She works in our Office of Health Equity, and she's going to go into some details on what her program is also doing for you, members of the community. And then I'll have some more comments on our relationship and the role of the health department. So Jewel, it's all yours.
All righty, thank you so much, Kevin, and thank you so much, everyone, for joining in on this wonderful panel here. Again, my name is Jules Bernard. I'm one of the epidemiologists with the Florida Department of Health in Hillsborough County. I'm going to go ahead and just share my screen for you guys here. And I have some good information for you. One moment. All righty. So again, Jules Bernard, one of the epidemiologists. So usually when I am presenting, I like to explain to people what an epidemiologist is. An epidemiologist, we focus on diseases, and specifically diseases, the study of diseases in populations. So I like to tell people that whenever someone goes to a hospital, whenever they go to a doctor's office, whenever you go to give blood, all states, including Florida, there's something called a reportable disease list. And by law, if you go to any of those entities and you test positive for one of those diseases on the reportable disease list, by law, that information comes to your local health department. And it's our job as epidemiologists to follow up with the individual and make sure that, number one, they are educated about such disease like COVID-19. We also make sure that we are containing the spread of the disease as much as possible. So we want to make sure we are preventing, we want to make sure that we are containing, and ultimately we want to stop the spread of such disease. And that's what we're doing every single day with COVID-19. Let's see here. So this graph is a very good graph. It shows you the United States, it shows you Florida, and it specifically shows what was happening. It shows that about summer of 2020, you saw that cases were rising astronomically throughout the United States, throughout Florida. You can see that they look very similar. Then cases started to decrease in the fall, but then cases spiked back during the holiday season. So thankfully, cases have started to decrease again, but it's still high. In a lot of places, including Florida, cases are almost as high as it was in the summer, okay? So that's why it's great to have these discussions, and we are still pushing out information as it pertains to making sure you do all those things that you're hearing on the news, that you're hearing within your community to control and stop that spread of this virus in our community. So this graph right here shows us specifically in Hillsborough County. And again, you can see that in Hillsborough County, like the state of Florida, like the United States, we saw a large increase in the summer. And then we saw a larger increase during the holiday season. Cases started to decrease again. So cases have been steadily decreasing slowly since early January. Specifically in Hillsborough County, we've had over 100,000 Hillsborough County residents test positive for COVID-19. So picture it like this: about 1 in 14 residents of Hillsborough County have tested positive for COVID-19. And so you're probably wondering, well, how sick are people getting? Is this real? Is this that serious? You're hearing all these numbers all the time, and all these numbers are saying people are getting COVID-19, but is it really that bad? And it is, unfortunately. As you can see here, about 10 to 20% of people who catch COVID are getting very sick. These severe symptoms of COVID can include very low oxygen levels and pneumonia. And we also are seeing that in hospitalization rates. Hospitalization rates vary by age and location. About 3 to 8% of people who get COVID have to be admitted and stay in a hospital. And among those people, medical interventions may need to be taken. So for example, a ventilator, having to be on a ventilator, or being intubated in the hospital. And sadly, we are seeing about 1 to 2% of those cases die. So in Hillsborough County, it's 1.3% die from COVID or complications related to COVID. One of the biggest risk factors for severe illness and death is age. That graph on the right-hand side that says death rate, you can see how the death rate starts very low for younger people, but as you get older, the death rate increases higher and higher. So with all that data, what does that mean? How does that affect communities of color, Black and Brown communities? Well, it shows that there are many factors that contribute to increased risk in minority communities, and Kevin and my colleague Allison will talk a little bit more about the specifics. But overall, chronic and toxic stress shapes social and economic factors that put some people from communities of color at increased risk for COVID-19. So an example is housing. So people of color tend to sometimes live in crowded conditions. We see multi-generational households, so people of different generations living under one roof. And in addition to that, we are seeing a lot of growing and disproportionate unemployment rates for some communities of color. Communities of color people who tend to work disproportionately represented in essential work settings, such as healthcare facilities, farms, factories, grocery stores, and public transportations. So some people who work in these settings have more chances of being exposed to the virus because they are exposed to a lot more people in the community. So with the public or other workers not being able to work from home, that is another example. They don't have paid sick leave. So people with limited job options likely have less flexibility to leave jobs that may put them at a higher risk of exposure to the virus. that causes COVID-19. So again, people in these situations often can't afford to miss work because there's no paid sick leave. They don't have savings saved up for essential items like food and important living needs as well. So what's great again about this panel, and I'm going to keep saying this, and all of the panelists I'm sure is going to say this as well, is that in a community, everyone has a role to play, and everyone can do their part to reduce the spread of COVID-19 and ultimately stop the spread of COVID-19. And there are a few things that we do know. We know that there are things that work to prevent and reduce the spread of the virus. So we know if, again, you are sick with COVID or you've been exposed to someone who's tested positive for COVID, stay home and especially stay away from others who may be immune compromised, our elderly individuals as well. You keep hearing stay 6 feet apart. Yes, please continue to practice that. And of course, increase hand washing and wearing your mask. And I apologize, and wearing your mask. And again, you're going to hear a lot more about the vaccines. We strongly encourage that when you do have the opportunity, you get vaccinated. Vaccines out now show to be about 95% effective at preventing COVID-19 and therefore keep you from getting severely sick and may prevent people from dying as well. Again, my name is Jewel. Thank you so much. And if there's anyone with any questions, I am here.
Thanks, Jewel. And we're going to just go ahead and go on over to Ali. She's in our Office of Health Equity. So Ali, it's all yours now.
Thanks, Kevin. Just going to share my slides as well. Okay. Great. So thank you again for joining us tonight. I'm Ali Wen. I'm the Program Manager for the Office of Health Equity within the Florida Department of Health in Hillsborough County. And so I wanted to take the opportunity to speak to some of the differences in health outcomes that we see for Black and Hispanic residents and why that places them at greater risk of COVID-19. So our Office of Health Equity works to try and understand these differences in health outcomes and works to try and prevent differences in health outcomes, as well as to try and mitigate differences in health outcomes through different changes and programs in our community. And so some of the risk factors we know that place individuals who are Black and Brown at higher risk are underlying or chronic health conditions. So think about conditions like diabetes, asthma, and heart disease. So these are some of the conditions that increase someone's risk of experiencing COVID-19 or experiencing it more severely. And so there are also barriers to accessing healthcare that increase your risk of having some of those conditions and in preventing and managing those types of conditions. So in Hillsborough County, we have differences in health outcomes, for example, with diabetes, where Hispanic adults are diagnosed with diabetes at higher rates than white adults. With hospitalizations from diabetes, we've seen that Black adults experience hospitalizations from diabetes at almost twice the rates of white adults. And then we also have seen that Black adults experience hospitalizations from coronary heart disease at higher rates than white adults. So you'll see in these two graphs that there are differences in having health insurance and having a personal doctor across race and ethnicity. So healthcare access is not the same in Hillsborough County. That, as Joel pointed out, some jobs do not necessarily provide paid sick leave, which makes it difficult to take time to go see a doctor for prevention, as well as to go see a doctor when you're not feeling well and trying to manage those chronic conditions before they become severe and experience a hospitalization, for example. And a lot of jobs do not offer health insurance. Individuals who are maybe unemployed or underemployed do not have access to health insurance. And again, that makes it difficult to see a primary care doctor, to prevent and treat those chronic diseases. Again, as Jewel identified, there's a disproportionate impact on Black and Brown communities because they're generally facing these frontline work environments more so than other communities in Hillsborough County. And so some of the ways that we can try and address this in our community are through some of the things that the health department is doing. So we offer free community wellness classes for diabetes prevention, diabetes self-management, as well as managing hypertension or high blood pressure. We work with community partners to increase access to health insurance enrollment. And so we have partners like the Family Healthcare Foundation that are working around throughout the year to help individuals who maybe lose insurance when they lose a job, or their income level changes and therefore their eligibility level changes. So they work throughout the year to ensure that individuals have access to enroll in health insurance plans. And then we also work to promote these resources in our community through our partners, through our website, and our community health newsletter. And so for more information, you can visit our website, and you can also email us directly at the health department. And Kevin, I will turn it back over to you.
Thank you, Ali. So let me go ahead and get my screen up as well. Okay. All right, so one of the things, and Ali just kind of touched on it, is that it is so important that we have partnerships. We can't do this alone. The health department, it's impossible for us to do it alone. We work very closely with our county government in Hillsborough County. We with this COVID-19 response, we are working hand on hand. It's called Unified Command right now, where the county is pretty much doing and working very, very closely with us to be able to respond to the pandemic. And so we want to make sure that we are serving all of our residents throughout the county and to the city as well. We have a great partnership, the medical community. We have great working relationships with our medical community, which is Tampa General, Advent Health, Bay Cares, our big hospitals here. And then of course, all of our urgent cares as well, and community groups, making sure that we are getting information to them and having them also take our message to the folks that they are also serving. And so we are definitely communicating with a lot of our community groups and our religious leaders, working with them to make sure that they could offer vaccinations to some of their memberships, which I'll talk on in just a bit, and just other community leaders that are out there. There are people here in Hillsborough that have a large following. They could be a local celebrity, and we make sure that we try to contact them and also have them let folks know exactly what they need to know. And so we have our targeted vaccine area initiative that we work with, again, Hillsborough County, USF, Hillsborough Community College, and Tampa General. There's a lot of partners involved with this. And the picture you see here shows one of the more recent ones we have. This program, the Targeted Vaccine Area Initiative, is the TVA missions that we do. The program allows for staff to visit and vaccinate seniors at senior homes, independent living communities, churches, and other targeted groups throughout the community. Some of the places we've recently been at, St. John's Progressive Missionary Baptist Church and Greater Bethel Missionary Baptist Church. Those are some predominantly Black churches here in the community. Also, community housing. Belmont Heights Estates is one of the places we've recently been to, and that has a very high population of Black residents. And San Lorenzo 102, that's where our Brown community, a lot of Brown community members are, the Hispanic community. And it's not just religious groups, but we have so many others that we work with to carry out some of these missions. Just recently, we also did one with the Islamic Society of Tampa Bay. We partnered with them to make sure that folks under them are also being served as well. Here on the screen, you see a few pictures of some of the places we've been over the last few weeks. And over the last couple of months, since January, we've completed about 40 missions to go to the different groups. Some are just groups of 50, some have a group of nearly 1,000 or more that we carried out these vaccination events at. And so far, since January, 16,000 people received at least their first dose of vaccine in these targeted initiatives that are primarily targeting a lot of Black, Brown community members, as well as those who are 65 years and older. And we know those folks are not able to necessarily just go to one of the public sites because they are limited by their transportation. They may have a work schedule that is just not friendly to being able to get to one of the places to get vaccinated. And so we want to make sure that we make it as easy as possible to get folks vaccinated. And right now we have a great amount of people that are taking that opportunity. But again, we do know that there is some hesitancy in the community that we want to make sure that we inform those folks right now. So as the vaccine becomes in greater supply, those folks will make the decision to go ahead and get it. So again, we could put this pandemic behind us much faster, and it could protect themselves, it could protect their, themselves, it could protect their other family members as well. And so how do we identify these locations? A lot of people sometimes ask, well, how do you choose? Or why didn't you come to my community? Well, we partnered with Hillsborough County Aging Services and other groups, and the Hillsborough County Aging Services is definitely one of the areas that we know is a great way to accomplish this goal. The Aging Services Department for the county, they have a list of individuals that will already receive county services because they need help. And so we know who a lot of these people are. We know where a lot of those individuals live. So if we have a list already, let's start working from that list. And that's exactly what we're doing. We also have homeless services. Again, the same thing. We know they have great partnerships with those who are out, the homeless folks that are out and about. And we make sure that, especially right now, those who are 65 years old or older and they're homeless, we're going to get in touch with them and we're going to try to offer them a vaccine. City of Tampa has been extremely awesome at working with us as well. You see Mayor Castro at many of the events and stuff because she supports the vaccine. She wants the residents to get vaccinated. So we're out there. Church and religious groups, you see a lot of our targeted vaccine area initiatives. We've been out and about taking care of some of the churches that we know could get a good amount of people, because one of the things you have to remember is it takes a lot of staff and resources to put on one of these events. And so when we have an event where we can attract a fair amount of people to get them vaccinated, that's what we're going to do to make sure that we are best utilizing our resources. Of course, elected officials, they know their residents, and for those who contact their elected officials, they let us know what's going on as well. And then we use something called the Social Vulnerability Index to identify some of the locations. And let's dive into that just a little bit. So there are a number of factors, including poverty and lack of access to transportation, crowded housing, may weaken a community ability to prevent human suffering and financial loss in a disaster or pandemic like we're in. So these factors are known as social vulnerability. It uses the US Census data to determine the social vulnerability of every census area. And one of the reasons for participating when it's census time, one of the reasons it's very important to participate in a census when it's going on is because this is how some of that data is collected. So anytime the census comes around again, make sure you participate, because this is one of the tools that we are using to determine where some of the needs are in our community. So let's, social vulnerability, still a big word. Let's try to look into it a little bit more. It refers to the ability to survive and strive when faced by things like a disaster or a disease outbreak. Again, just like what we're in with the coronavirus. And reducing social vulnerability can decrease both human suffering and economic loss. The health department and other partners, we are always working to be able to serve you. And again, social vulnerable populations include those who have special needs, people who don't have vehicles, they have disabilities, they're older adults, people with limited English proficiency, and a lot more. There are 15 social factors used to rank an area. And so the map you see here is the social vulnerability index. And anywhere you see on red here, that's kind of like the city of Tampa area, University area, Temple Terrace, parts of it, Sefner and Thona Tasasa, that's kind of closer to the I-4 north and south of the I-4 corridor. Those are some areas that we know have a lot of people who that need our help, need us to help them out a little bit more to be able to reach out to them. And that's some of the areas you'll see a lot more targeted efforts in to be able to reach those who really need a little extra assistance. Those in orange include those like Dover, Plant City, Town and Country, Ruskin, some parts of Sun City and Apollo Beach and Gibsonton and Lutz. Those areas, we know that there are kind of a moderate, medium amount of individuals living in those communities that need our assistance. And I'm not seeing those who are in green and blue, which is like Pebble Creek and northern Thurno-Tasasa, Calwood area, Citrus Park, some parts of Lithia and Waimama, Lutz, Land O'Lakes, Odessa. Those places, while there are, we still want to make sure we communicate with them. A lot of folks that live in those areas, they are able to come to our vaccination places. So even though we are still, again, pushing information out there and setting up different events in some of those areas as time goes on, we are making sure that we are doing it in a more targeted area where we know there's a greater need in order for us to be able to provide the services that we want, which is, again, to protect the life of those who live here in Florida. And of course, everyone could benefit from us helping them. So that kind of concludes our health department presentation. We will be here for questions for anyone that has any questions. And again, thank you guys for joining us. And I'm going to pass it back to you now, Emerald.
All right. Thank you so much for that presentation. I think that was a very thorough presentation and hopefully helped our attendees understand, again, exactly what is going on in our community. So thank all three of you guys for your time and for putting this together. And I want to encourage people, if you have questions, please put that in the chat box. We're going to do our best to answer everybody's questions so long as we can stay on time here. And next up, we are going to introduce Dr. Laurie Taylor. Thank you so much for being here with us tonight. Dr. Taylor is a board certified radiologist, and she completed her undergraduate work at Dartmouth College with a BA in psychology in 1984. She graduated cum laude and was a part of one of their honor societies. She did her medical training at the University of Michigan, where she received the Merit Achievement Award. She's also a member of the American College of Radiology, the Florida Radiology Society, and the Society of Advanced Body Imaging. And she's been working with University Diagnostic Institute in Tampa since 2014. And what Dr. Taylor is going to do for us tonight is just so important. She's going to be talking about some of the differences between the vaccines, which I know a lot of people had questions about. Should I get Moderna? Should I get Pfizer? What's going to be going on with Johnson & Johnson? Do I need to absolutely have 2 shots? Will the second shot make me sick? And she's also going to be talking about a lot of the myths that people have about the vaccine. So I know we all want to address those concerns. So this is very important. And again, if you have questions, please make sure that you drop those in the chat box. I will be monitoring those. But with that, we're going to turn it over to Dr. Taylor. Thank you so much.
Thank you so much, Emerald. And thank you for moderating this very important discussion on the COVID vaccines. As people probably know, we currently have 2 FDA-approved vaccines that are being used in the United States, the Pfizer and the Moderna vaccine. Both of these vaccines were developed using messenger RNA technology, and I will talk about that a little bit more later. But they both are about 95% effective in preventing serious disease and hospitalization. So excellent efficacy rates. Both of these vaccines require 2 doses in order to reach that 95% efficacy rate. And with the Pfizer vaccine, it's 2 doses taken 21 days apart, and the Moderna vaccine is 2 doses 28 days apart. And you need both those doses to reach that high level of effectiveness. So the Pfizer vaccine has been approved for ages 16 and up, and the Moderna vaccine has been approved for ages 18 and up. Now, there are different storage requirements for both these vaccines. The bottom line is that the Pfizer vaccine needs to be in very, very cold temperatures and needs specialized freezers to be stored. And so a lot of times the Pfizer vaccine is going to be seen in more of a hospital setting rather than in your doctor's office or in pharmacies. The most common side effect from getting the vaccine is injection site pain. So right at the arm where the injection is made. But other side effects include fatigue, maybe body aches or chills. These typically don't last very long, maybe 12 to 24 hours, and are more common after the second vaccine, after the second dose, because that's basically a boost to the prime that was given with the initial shot. So there is a third vaccine that's on the horizon, and that is the Johnson & Johnson vaccine. And that one actually is going to be maybe a game changer for us in that it is going to be a single dose, so we don't have to worry about compliance. And it's also going to be easily stored in refrigerators, and so that one can be distributed to doctors' offices and pharmacies and can be stored for several months without it expiring. So this vaccine is actually getting ready to be reviewed by the FDA next week for emergency use authorization. So hopefully in the next couple of weeks, we'll have that approved and have that vaccine out and ready to go. The Johnson & Johnson vaccine was tested clinically in their clinical trials all over the world. And they actually were tested during the time of these emerging variants. So their efficacy rate is a little bit lower than the Pfizer and Moderna, which was not tested during spreading of these variants. In the United States, the Johnson & Johnson rate of efficacy is 72%. And people may say, oh, well, 72%, I like 95%. We all like A's. But in the world of vaccines and all, if the FDA considers anything over 50% to be effective and safe, they will approve it. So it's still a good, very effective vaccine. As I mentioned, even though these vaccines are very effective, there's still a lot of hesitancy in wanting to get the vaccine, especially in the Black and Brown community. And so I know a lot of people are waiting to see how their family and friends react to the vaccine before they get it, but there's also a lot of misinformation out there and a lot of myths about the vaccine. So I just wanted to talk about a few of those. The first one is that if I get the coronavirus vaccine, I will get coronavirus infection. So there is no live virus in the vaccine at all. So you will not get infected with the virus at all. So that's not true. Another piece of misinformation is that, it's developed too quickly and it's just not safe because they developed this in less than a year and now they want us all to take it. Well, actually, this messenger RNA technology has been around for at least a decade. They've used it in cancer research. They've used it with other viruses, specifically during like the SARS outbreak in the early 2000s. So this technology was already there. And once we got the gene sequence of the code of the virus, we were able to plug that information into the technology and develop a vaccine. So it is a safe technique. Even though it seems like it was developed very quickly, we had that technology available. One of the more important pieces of misinformation is that, and I understand the concern, that this vaccine is going to somehow change my cellular makeup, my DNA. And so what I want you to know about this messenger RNA is that it does not enter into your DNA. It does not enter into the nucleus of your cell where your DNA is located. Basically, what the messenger RNA does is it gives the instructions to the body to make one of the spike proteins on the virus. That in turn elicits an immune response in your body to make antibodies to that protein, so that if you do come in contact with the coronavirus in the future, you have antibodies to neutralize the virus. So it does not change your makeup. That messenger RNA eventually fades away in the body and is excreted, doesn't stay, doesn't change your genetic code. And then the last thing I wanted to talk about was the fear of allergies. And about 55 million doses of the vaccine have been given so far, and there's been less than 100 allergic reactions. And so it's very safe. Of course, if you have severe allergies to the point where you need to carry an EpiPen, you may want to talk to your own personal care physician, to your primary care physician, to see whether or not you should take this. And of course, if you're allergic to any of the ingredients in the vaccine, then you probably do not want to take it as well. But otherwise, it's extremely safe.
Thank you, Dr. Taylor. We appreciate that. I'll have some questions for you at the end of our session, but for now, we're going to move it over to Dr. Kevin Sneed, who I've had the pleasure of interviewing on many occasions, and a lot of times I'm calling him up like, Dr. Sneed, can you interview with me for a story? And he's always so kind and gracious to give me his time, and has talked with us so many times about this issue of COVID-19 in Black and Brown communities. And I know that through his organizations, he's done a lot of work in the community to make sure that this issue is being addressed. But I'm going to go ahead and give him the official introduction. Dr. Kevin Sneed is a tenured professor and the founding dean of the University of South Florida College of Pharmacy. He also serves as senior vice president for USF Health. His educational background includes a Bachelor of Science degree in biology with a concentration in microbiology from the University of Central Florida. Dr. Sneed received his Doctor of Pharmacy degree from Xavier University of Louisiana College of Pharmacy, where he received numerous clinical and leadership awards. And he also completed an ambulatory care, primary care pharmacy practice specialty residency at Bay Pines Veterans Administration Medical Center. And I just wanted to say to everybody else, we want to make sure that we're pumping up everybody's accolades. Again, you know, the name of this forum is Building Trust in our Black and Brown community. So we want you to know everybody's qualifications and understand that these people that are speaking to you tonight have done the work and they know what they're talking about. And they are highly qualified and skilled in this area and are giving you the very, very best information possible that is going to help protect you, your family, and your community. And with that, I will turn it over to Dr. Sneed.
Well, Ms. Morrow, thank you very kindly for that introduction. And I just want to echo the words that were said at the very beginning. You've been such a stalwart person in our community, really bringing this issue to life for many of us, especially in communities of color. What I'm going to do, I'm going to share my screen with you all. Being a professor, I have to do death by PowerPoint for just a moment. So if you all could just bear with me for a quick second. And so basically, I just want to share information just about a little bit more about the virus, the makeup of the virus, and exactly what it does in your body. I really want to thank Dr. Taylor for that very excellent overview of the vaccines. So I'm putting this cartoon up just for a quick moment, not to go through the entire life cycle of the virus, but really to bring your attention to once the virus gets inside of your cell, the most dangerous part of it is actually the RNA that's inside of the virus. When it unfurls and it gets into your cell, now that particular virus RNA strand is gathering proteins and it's actually remaking itself, but it's not just doing one for one. It's like one will go in and 1,000 will come out. And that's how we wind up getting millions and millions of copies of the virus in your body in a fairly rapid manner. Just very quickly, the variants that we're hearing about, it has learned how to do that even more efficiently than it did even before. And so one of the main things I really want to share with all of you again, when we talk about the spike protein, the little red spikes that we find on the outside of many of the images on TV, I want you to think of that spike as being very similar to Velcro. And every human being on the planet has a receptor called the ACE2 receptor in your body, and it's all over your body. And in just a moment, I'll show you exactly where it is. And that red spike attaches on to that cell in your body, and that's how it gains entry. Now, to kind of give you an image, think of your favorite wool sweater. And if you took a piece of Velcro and you stuck it onto that wool sweater, Well, number one, it's not going to come off very easily. And if you did try and take it off, it would cause damage. And so again, when it gains entry into the cell, that's what winds up happening, and it gets all over the body. Now here, what you're looking at are different organs in the body. And I know very often we think about it as being just a respiratory virus. And we see people on TV, they go in the ICU, they're on ventilators, they're on oxygen, they're having coughing. However, it's very dangerous to understand how that virus can get and infect many parts of the organs in your body. Again, number one, it can affect the heart, the gastrointestinal tract. One of the early symptoms that we were paying attention to a year ago were the number of people that had GI and diarrhea symptoms. Of course, it can be in the lungs, and it can even cause kidney damage. So we understand that, I want you to understand that we're not just talking about a respiratory virus here. We're talking about a virus that can affect many different organ systems. Now, I think earlier, Joel did a very good job of explaining our maintenance and oversight of people with diabetes and other chronic conditions. I just wanted to explain that and dig a little bit deeper into that. For individuals that have chronic cardiovascular conditions like diabetes or high blood pressure, those that fall into the obese or overweight category, those that may have been smokers or asthma or any other thing that can injure the lung, already just by virtue of having that condition, if it's not well controlled, very often you can build up inflammatory proteins inside of the body. If an individual has any of those conditions and it's not well controlled, we're talking about the potential for what we call the cytokine storm, or a really overrun system that revs up with an enormous amount of inflammatory proteins, potentially leading to further organ damage. And so very often, many of the therapeutics that we're trying to accomplish right now are designed to reduce the chance of that inflammation from overtaking your overall organ systems, and thereby allowing your body to get the antibodies and other therapeutics that we may be able to give to you, giving them a chance to work. Just very quickly, I wanted to once again go through all of the different things that can happen in the body. And many of us have known people, or we've heard about people that may have lost smell and taste. Absolutely, that can happen. That's what we call a neurological effect. But let me bring your attention over here on the far right. A little bit more than a year ago, or a little bit less than a year ago, we began getting reports out of Philadelphia up into the Boston corridor and everywhere in between of abnormal clotting that was beginning to occur secondary to being infected by this, what we thought at the time was just a respiratory virus. And so when you see on the right, we have thromboembolism potential, meaning you can develop a deep vein thrombosis or a deep vein clot. You can have clots travel to the lungs, or you can have that virus attach onto cardiac tissue, as I showed you before, and it can lead to a condition known as myocarditis. Now, it's not uncommon that many viruses can cause that problem, but typically and usually only 1% of individuals, for example, that are infected with the influenza virus will wind up having these cardiac conditions. But what we're finding now with the coronavirus, or the SARS-CoV-2 version of it, is that anywhere from 22 to 35% of individuals that become infected can have these cardiac conditions. So I just want to kind of give an overview of why it's so important that we want people to get vaccinated. It's not just a respiratory condition. It can cause further damage. Now, just to kind of echo a little bit of the information very quickly that Dr. Taylor told us, I know people feel like, we walked into the kitchen on April in 2020 and we cooked up these vaccines and they're brand new, they've never been tested. Well, nothing could be further from the truth. Very quickly, I wanted to bring your attention back to the fact that it was actually President Obama during his time in administration that really invested time and energy in actually developing the messenger RNA technology that we find today. And he gave a total of $150 million back in 2014 to make sure that we were advancing the notion of the messenger RNA technology. And the only reason he did it was because we often forget it was President Obama that had to deal with not one, but two pandemics during his time. The first one was H1N1, and then the second one was Ebola, where he deployed a large number of people from the public health service here in America over to Africa to try and combat it there before it had a chance to spread around the world. And he knew that we needed to have a rapid deployment system for vaccine development to protect us from potentially the next pandemic, which in a speech he gave, he mentioned it may be a 4 or 5 year period when we found the next one. The other thing I wanted to really bring attention to was the fact that African Americans have been right there at the very beginning, helping to develop the vaccines that we are now deploying right now. Here I show a picture of Dr. Kizzmekia Corbett, and she was one of the lead researchers that helped to develop what is now the Moderna messenger RNA vaccine that many of us are now taking. And also, even though I don't have it shown here, just for time's sake, the president of the National Medical Association, Dr. Leon McDougall, he and I have had occasion to be able to speak. And I can assure you that from the very beginning, we've had oversight and communication with the FDA, talking about the vaccines, how they were developed, the safety, how effective they would be, but then more importantly, making sure that we were going to have equitable distribution of any and all vaccines that were being developed. I won't spend much time here. I think Dr. Taylor did an outstanding job of talking about the therapeutics. But the last thing I wanted to really show you is the fact that what we're trying to do, we want to build antibody armies so that if and when you do come into contact with the actual virus, the coronavirus, that we already have your antibodies ready and waiting to protect you from becoming very ill from being infected. We want to protect all of your organ systems that I talked about earlier. So it's very important and critical to understand that. And the last 2 slides I have here really show the importance of the impact of what has happened with the African American community, not only here in Florida, but across the entire country. At one point in the very beginning, African Americans were dying at 3 times the rate of our white counterparts. That number has steadily gone down over time, but it has only gone down as more and more people from Middle America, the Dakotas and the Oklahoma area, Montana, Wyoming, and other areas where now it has become much more widespread in Middle America. But even now, most recently, we are still at 1.5 times the rate of death as our white counterparts. And here you can see our Latino and our indigenous populations, our Native Indians, are also being more affected. And also it being more affected in every state across the entire country. And we knew that from the very beginning. So I'm going to stop there. I look forward to having a very robust question and answer session with all of you. I just wanted to show you that I too have taken the vaccine. I promised I would do it long before the vaccines came out, and I stood in line when I had the opportunity. And so again, I look forward to answering any and all of your questions and along with my panelists. But thank you very much for your time.
Thank you so much, Dr. Sneed, for that wonderful presentation. That was phenomenal. And I do see a couple of questions coming in via our chat. So I will read those questions off and throw it out to our panelists, and any of you all can decide to answer this. So the first question that we had coming in was, what is known of any impact on lymph nodes? Have you heard of a lump near the vaccination site as a side effect?
Yeah, I can take the first stab at that. What's actually happening anytime that we begin to rev up the immune system, sometimes, and it's not overly common, but sometimes you can have a little bit of what we call lymph node involvement. And very often that can be somewhere in the armpit area, and it can actually extend sometimes up and even into the neck area or across your clavicle area. And so when you go and see your physician, and sometimes they will begin pressing on the areas. Now, what we do know, and what we currently believe right now, if this does occur, that it will and should be very temporary. There's nothing dangerous about it. As Dr. Taylor mentioned earlier, the messenger RNA vaccine, when it's injected into your body, it's only going to be there for a very short amount of time. It doesn't really have time to interact with much of your body. And this may simply be a response, we feel, to your body building a robust antibody response to being vaccinated. It should be temporary and should be gone within what we think would be about a 60-day period following the final vaccine.
Thank you so much. And then the second question that I see coming in is, what happens if you miss the second dose in the 21 or 28-day time frame?
Okay, I can take a stab at that one. So if you miss it, you should still try to get it as soon as possible, the second dose as soon as possible. The first dose will probably protect you up to about 50%, but if, you definitely want to get to that 95%. level, and I would suggest that as soon as possible you get the second dose. They have actually talked about, just because we've had limited supply of vaccine, that they actually were contemplating whether or not to extend the time frame between the two doses to try to get more people their first doses. But they decided that they really needed to stick to what the clinical trials showed and not alter that. So I just say, as soon as possible, get this, try to get that second shot.
Thank you, Dr. Taylor. I see another question coming in, but before that, I'm going to throw one out. If someone can address the long-term effects that COVID has on your lungs and different things like that, even for people who may not have had a symptomatic case, because I think that there's an attitude out there that, well, I don't need to get the vaccine. Even if I get it, I'm young, I might not get very sick, but that's not true. We recently just did a story with a woman who had some really bad scarring of the lungs and some issues that kind of happened from that. And that's something that can happen even if you don't get physically very sick and ill from COVID. It can still really wreak havoc on your body.
Yeah, with Dr. Taylor, did you want to go first, or you want?
Okay, sure. So yes, with the lungs being affected, and like Dr. Sneed said, it's kind of it's the cytokine storm, where it's your body's reaction to the virus in the lungs that really causes the damage. It's not really the virus itself, but it's your body trying to get rid of the virus. So it causes a lot of scarring. And we see that on imaging with CAT scans. And it doesn't have to be in a patient that was hospitalized. I know people who were never hospitalized, but are still what we call long haulers, who are still suffering from shortness of breath just from having had a mild infection. So it's the scarring is something that's significant. We just don't know if it's something that eventually is going to be reversible or if it's going to be permanent scarring. And it tends to be pretty severe when you look at it compared to other disease processes that cause scarring in the lungs, such as emphysema and COPD.
Thank you, Dr. Taylor. Were you going to jump in, Dr. Sneed?
Yeah, I think she gave a very good explanation. The only thing I was going to mention is the fact that, and we're finding it now, probably, and it doesn't have to be up to the level of being severe, but we are finding lung challenges beginning to occur, and probably up to about 50% of the people who have been affected, even though they were not hospitalized, they weren't on a ventilator, they weren't on oxygen therapy. Some of these people were actually very mild. And I think that's the real danger and message we need to tell people, and why we want people to get vaccinated. We want you protected. You don't have to have been affected very negatively in order for it to hit you and cause that scarring. And right now, we really don't know the long-term ramification of what that will mean, whether it be a year from now, 5 years from now, or longer. And also the very same thing, we're really beginning to have a greater concern about the kidneys being affected, because, again, kidneys are pretty resilient in the short term, but we don't know right now the long-term impact of what that may mean for kidney damage in the long term. So again, you don't have to be negatively impacted in the hospital for this to be a very dangerous virus.
Thank you. I see another question coming in. I'll take this first one, and then I have a question for those at the health department. But this one is for everyone. What advice would you give to someone with underlying health concerns that's preparing to take the vaccine? Is there anything that they would need to know if they have certain conditions? Is there something they should know before getting the vaccine?
Yeah, I'll take the first stab at it. I've been doing a lot of surveillance, not only here in our country, but around the world. And many of the associations out there, the rheumatological associations, the OBGYN groups, they're all beginning to recommend that people become vaccinated, understanding that there's nothing more dangerous than getting infected with the actual virus. Underlying health conditions, really, there's nothing dangerous that we can detect about getting the actual vaccine. But we do understand that there's great potential, because of what Dr. Taylor and I have mentioned already, that if an individual were to become infected with the actual virus, it could actually cause an enormous amount of damage, and we want to prevent that. And so People have a concern about, autoimmune disorders, for example. Well, the biggest challenge I think we're waiting to really find out is whether or not you will get the full complement of antibodies. And I think we're getting evidence right now that people are getting protected when they become vaccinated. Dr. Taylor or any of the others, I'm not sure if there's anything else you may want to mention, but I just wanted to mention that the associations around here in the United States and around the world are recommending that.
Yeah, I don't really have much to add. I mean, I totally agree with what Dr. Sneed said. They're actually starting some clinical trials right now on pregnant patients to see whether, to see how they do with the vaccine, but they're not really waiting to see the results. They're actually recommending they get the vaccine because pregnant women are like 75%, have a 75% risk of severe COVID infection. So that would be the only thing I would add.
Thank you. And we've got just a few minutes left here. I do want to make sure I get this question into the health department. You guys have talked about those targeted vaccines that have gone out to some of our communities here in the Tampa Bay area. How can people make sure that they know about this and can get in on the next round whenever that's available? Is there a place where they can sign up for updates or learn about alerts or anything like that?
Absolutely. So we do have it on our website, hillsborough.flhealth.gov. And in terms of signing up for updates, we do have a newsletter that you could sign up for. If you go to our website, and there is going to be a link on there that says sign up for our newsletter. And if you select that I am interested in, and then the little option that says COVID-19, you could select that option. And there's going to be other options there because it's not just COVID-19 information that we'll send out. There's stuff on the diabetes prevention programs that we have and just other programs that we do have at the health department. If you just want something on that on that topic, we will certainly send you information on just that topic. But if you're interested in updates on knowing when we have other things turning on, that is one of the resources. Another resource would be Hillsborough County government's website. That's htflgov.net/vaccine. They too are doing a very good job at posting it there. And of course on social media. Take the information again from a lot of the government resources, the health department's website and the Hillsborough County government's website or the city of Tampa's website and social media sites, because we're going to have the most up-to-date and accurate information. Things have changed a lot since the beginning on when the vaccine rollout started to begin. And sometimes the old information might be picked up or not updated on some of the other sources. So we want to make sure that please visit either the health departments or the county's websites for the latest update on what type of, or where we are offering the vaccines at.
Thank you so much. We've got 3 more questions in here in just a couple of minutes. I would really like to get to these last couple of questions in here. And a caller that's listening says, how long should you wait to get the vaccine after you've been diagnosed with a positive COVID test?
Right. So the recommendation right now is that you probably have immunity from having had the infection for about 90 days or 3 months. And so the recommendation is that after that 90-day period, you go ahead and get the vaccine.
Thank you. And the next question is, when can we expect the vaccine to be available to the next group of people in the distribution plan? In other words, when can someone who is not in the special group, such as over the age of 65, expect to be able to be vaccinated?
So this is determined by the governor, Governor DeSantis. He has an executive order right now that says healthcare workers, those who are 65 years old and older, as well as those who might have comorbidities. However, that is determined by a hospital. That is not determined by the hospital or any others. So if a doctor identifies that this person needs to get the vaccine, they can go ahead and do so if they have the vaccine available at their hospital. And so it's not from your private doctors at home. Typically at this point in time, that is again determined by one of the hospitals in the area.
And then the last question that we have in the chat is, I think, also directed to the health department. Has the health department held vaccine administration events at all the underserved/at-risk locations mentioned on the map shown?
Not every single one. Again, we do try to make sure that we gather resources in certain areas, but we are working on expanding that. If you just look at the data that is available on the health department's website where we've been, you can see that it continues to expand. Remember, this vaccine is in very limited supply, but it is increasing. So as once we get more vaccine, we're going to have more and more initiatives to get to all of the areas eventually. Soon, in several months from now, hopefully it's going to be in just about every pharmacy, every urgent care, every hospital, and we'll have that supplied to just give to anyone who wants it. But we're not there yet, which is why we have a slower rollout and prioritizing the folks that we really need to target. And we are certainly going to be coming to different communities in our targeted areas as soon as we are able to do so. We have hit many already. Again, we've vaccinated a whole lot, but we have a lot more work to do.
We definitely do. And then last thing to throw out to you guys, there may be a misconception out there in the community that if you get a vaccine, I don't have to wear my mask anymore. I'm good to go to gatherings and I can, have myself a good old time, like life is back to normal. But I don't think that any of you will agree with that. I see some of you all shaking your heads. So could someone clear up that misconception, because that's a big one, and it's going to be very important that as people get their vaccines, that we still continue to do the things that we're doing until we are actually in the clear, which won't be right away.
I can go ahead and start that. Yes, you get the vaccine, which is great, but you still cannot go without your mask for a couple of reasons. The vaccine, again, is only 95%. It's not 100%. Nothing is 100%. But also, even though you are vaccinated, you may not get sick, but could be an asymptomatic carrier of the virus and then pass that on to someone else. So it's very important that you continue to wear your mask, wear it properly over nose and mouth and under the chin. And they're, even recommending double masking to help with the fit of some of these masks, so they fit tight along across the face. And so, unfortunately, we're not going to be there yet until we can actually get enough people vaccinated, what they call herd immunity, and that's about 70 to 85% of the population that needs to be vaccinated before we may be able to start, not wearing the mask. But for now, masks are still mandatory.
Okay.
Let me add something on to that. Thank you, Dr. Taylor, for mentioning that. There's a very high level publication that came out. It hasn't been put out all the way, but I've had a chance to read it. The highest transmission rates here in the country have been from the age of 25 to 49. And so even, right now, we understand the population is probably allowing the pandemic to continue to fester across the entire country. So we want everybody wearing a mask, even though you've been vaccinated. We don't understand the full impact right now of the variants. And we need everybody, especially in that younger age group, to be wearing the mask, because if we can cut that down, I think we have a great opportunity to catch up much quicker when the vaccines are widely distributed for everybody.
And I do see there were questions coming in the chat and then in the question and answer. I think we're just down to the last two, and then we'll wrap it all up. So we won't be taking any more questions, but we will get to these two. One, how long is the shot good for? And two, is it safe to get the vaccine prior to getting a mammogram?
I do not know of any contraindication for getting a mammogram in concert with the vaccine, so that should not prohibit anybody from getting the vaccine if you need a mammogram.
The whole, that question is coming up much more about the mammogram. It's really going back, Ms. Morrow, to an earlier question about the lymph nodes. Some people are beginning to wonder if you actually have some involvement that may have a temporary change in breast tissue, and probably Dr. Taylor would be the one that would see that in her practice, and then recommend another one. So there is no guidance from the CDC right now on what to do about the mammograms, but it's something that is being paid attention to at the moment. And also the shot, the shot itself. Right now, we do have evidence that the antibodies are lasting for at least a year. They're anticipating it may last longer than that, but the challenge will be the variant and the mutation rate of the current coronavirus. If it mutates into something less severe, then maybe we don't need to, but it does appear that it could mutate into something more severe. And so it may turn out to be an annual vaccine that we need to get that is matched up genetically to the current, to the most current virus that we're trying to combat. So stay tuned on how long.
All right. Well, I think we got to everyone's question, and I think that we addressed so much information here. So I want to thank each and every one of the panelists, distinguished panelists that took time on a Sunday evening to join us and to answer your questions and to inform you. That's what we're all about. Certainly what I'm all about as a journalist is information and making sure that people have the information that they need to make informed decisions. And again, when we're looking at something like COVID-19 that has really ravaged the Black and Brown community, it is so important that now that we're at a point where we're looking at vaccines that are available, that we're looking at every single option that is available to protect our community. So I want to thank everyone once again. This has been wonderful for me, and I hope wonderful for everybody who's attended. And so I will give it back over to Tina Young with Project Link, who is always doing wonderful things in the community. I got to pump up Miss Tina too, because she's been great and has been someone who, when I first came to this community, really kind of took me in, and I was always asking, well, what's going on here and what's going on there, as I was trying to understand how is the Tampa Bay area African American community unique, and what are the challenges this community faces. She's always helping me out. So thank you, Tina. It's been wonderful working with you over the years. And thank you for putting this event together. And Dr. Taylor, you as well. Thank you.
Again, Emerald, thank you for your excellence as always. You have been putting the lens and attention on the Black community since you've been here. And I appreciate that in a journalist, because we don't always receive that. Again, I just want to thank everybody for spending your Sunday with us, our partners, the Links Incorporated, USF Health, College of Medicine, College of Pharmacy. Who else am I missing? University Diagnosis Institute. So many people that it takes to put something together and to get this valuable information out. And we have to continue this conversation to make sure that we're educating the individuals that truly need it and want it. So again, thank you all for spending your Sunday with us. And I would hope that we can continue this conversation. I know Dr. Sneed is always on board to educate the community. So we will be reaching out to continue this conversation. So thank you all and have a wonderful night.
Thank you.